On Tuesday, June 21st, 2016, Cook County Board President Toni Preckwinkle and Cook County Health and Hospital Systems CEO Dr. Shannon were joined by Cook County Commissioners Jesus Garcia and Jerry Butler, along with medical professionals and advocates, in endorsing the statement by the American Medical Association that gun violence should be addressed as a public health crisis.
Stroger Hospital has one of the top trauma units in the country, if not the world. And there's one reason for it. They have plenty of experience dealing with victims of gun violence. And it's gun violence that brings us here today. We're here because we want to see a public health crisis treated as a public health crisis. And we're in good company. Recently, the American Medical Association, the AMA, which has a long-standing policy of supporting common-sense gun laws, has decided to define gun violence as a public health crisis. Way overdue, in my mind. Too often in recent years, as a nation, we've had to pause and mourn the victims of gun violence. The tragedy in Orlando is only the latest case of carnage. Locally, we're confronted almost daily with the shootings that occur in our own neighborhoods, many of them fatal and all of them life-changing. We dread the upcoming weekends of summer and the so-called penetrating trauma they historically have brought. Let me just say, I was an alderman for almost 20 years, and I used to pray for cold and rainy summers, so people would stay in their houses and not be out on the street fussing with each other or with the police. There's no acceptable amount of interpersonal violence. Gun violence, the root causes that lead to such violence, and the easy availability of weapons are issues that we all need to confront every day in any way that we can. This is not just an issue of policing. We must consider all the contributing factors, human and resource related, that fuel this crisis. I'm grateful to the AMA for lending its influential voice to this issue and look forward to working with them to end the ridiculous prohibition imposed by Congress 20 years ago that keeps the Center for Disease Control, CDC, from researching gun violence. The American Medical Association has announced that it intends to challenge that prohibition, instigated by the National Rifle Association. What a surprise. We have to ask, what is the NRA and their congressional amen corner afraid that researchers will find? The NRA is funded by gun manufacturers. Would we allow brewers and distillers to block federally funded research into alcoholism? I don't think so. Sound research can inform good public policy to address this crisis. Prohibiting the Centers for Disease Control from conducting such research flies in the face of common sense and hinders our ability to address this national scourge. The crisis will not be solved overnight, but surely research into this issue is a critical step in the right direction. We must join the American Medical Association and make our collective voices heard and join with others in a call to action. We cannot presume to know exactly what research will tell us, but we do know that we cannot continue down the path of more guns that kill more efficiently and that decimate and traumatize more of our communities.
The violence that this city is experiencing, 300 homicides already, and it's not yet midsummer, is a terrifying statistic to contemplate. As we were standing outside the hospital just 5 minutes ago, I had a young father of 8 come to tell me that he was rushed to Stroger, very grateful, because he believes that his life was saved. He was shot 10 times. It's a miracle that he is walking amongst us. He's very grateful to be alive. One more example of the type of violence that is out of control because of the accessibility to guns, and not just handguns, but assault weapons, military-style weapons. He was shot with one of them, lived to tell about it. On Sunday, in my district, in the back of the Yards neighborhood, there was another shooting where another AR-15 assault rifle was used. That one ended in a fatality. So we stand here today to urge Congress to take action, to disregard the bad advice received from the NRA and the gun lobby. As long as that influence continues, our communities will pay the dear price. This violence is real, it's every day. We need to do something about it.
Dr. Shannon further backed the AMA's intention to actively lobby Congress to overturn legislation that for 20 years has prohibited the Centers for Disease Control and Prevention from researching gun violence.
Violence is complex, it's multifaceted. And like any public health problem, it's got to be addressed with an equally careful, complex, data-driven approach. Just as we use research to curb the spread of infectious diseases like Ebola and Zika, research is needed to understand better how to address gun violence in Chicago and in our country. For more than 20 years, our nation's public health authority, the Centers for Disease Control and Communication, has not put any efforts or any funding in gun violence research because of pressure from the National Rifle Association. And more recently, because of that pressure, they've chosen to continue to zero fund gun-related research. It's ironic and painful that that followed groundbreaking research by an emergency medicine physician that was published in the New England Journal more than 20 years ago. That research, done at a time when such research was funded nationally, showed that having a gun in a home, shockingly, increased the odds that someone in the home would be killed by a gun. Research is needed to get a better understanding of public health issues and to develop effective interventions rather than casting about for easy solutions.
Last year, Cook County's health and hospital system treated approximately 900 gunshot wounds. The first comprehensive trauma unit was established in Cook County, and the unit, now at Stroger Hospital, remains one of the busiest in the nation.